Hello and welcome to another episode of Transport in Africa, a podcast dedicated to spotlight cutting-edge research, innovations, and ideas shaping transport systems across Africa. I am your host, Polycarp Chebe. In each episode, we sit down with a researcher, practitioner, or change maker who is redefining how mobility works in Africa. In today's episode, we will be discussing inclusive mobility infrastructure for people with disabilities, why it matters, the challenges that currently exist, and what can be done to make transport systems more accessible and equitable. In Africa, estimate shows that more than 20% of people live with some form of disability. Yet, in many countries, the transport needs of people with disabilities are often overlooked, and universal accessible mobility infrastructures remain a major challenge. As such, people with disabilities face significant barriers in accessing education, employment, healthcare, and other everyday activities. In many cases, this lack of accessible mobility contributes to higher levels of employment, poverty, and social exclusion. To help us unpack this important issue, I am delighted to welcome Dr. Olayemi Dixon, whose PhD research focuses on inclusive mobility infrastructures for people with disabilities. Dr. Olayemi is a research officer and transport specialist at the National Center for Technology Management with over a decade of experience in policy research and knowledge-based development. She will be sharing key insights and reflections from her completed PhD research. Hello, Dr. Olayemi. Welcome to the show. And once more, congratulations for completing your PhD.
Thank you very much. It's nice to be here with you.
Okay, Doc, before we get into the conversation proper, can you tell us more about yourself, your research background, and the motivation behind your research on inclusive mobility infrastructures for people with disabilities?
I am a transport professional and a research officer. I work for National Center for Technology Management here in Nigeria as an in-house specialist and a research officer. Talking about my background, I have my first degree in transport management technology. I have my second degree in technology management, but with option in transport. And I have a PhD degree in transport and logistics. Also, I'm a chartered member of the Chartered Institute of Logistics and Transport, Nigeria. I'm also a full member of the Chartered Institute for Transport Administration here in Nigeria. And I was one of the top 100 career women in Africa.
Very much. Can you briefly share with us your motivation behind this topic on inclusive mobility infrastructure for people with disabilities, specifically in Africa?
You know, when you started your introduction, you started with mentioning the population of people with disabilities. So that is one of my motivating factor. And also, despite the fact that there are legislative rights for this category of people, I think they are still left unattended to in terms of mobility infrastructure. Let me start by saying that we have over 650 million people, which constitute 10% of the world's population with disability. And 80% of that figure lives in developing countries, according to United Nations, and over 1 billion people are estimated to experience disability globally, according to the World Health Organization. And this corresponds to about 15% of the world's population, according to the Nigerian Population Commission. Out of these 218 million people in Nigeria, population in Nigeria, we have an approximate number of 28 million people with disabilities. We have 3 million people with disabilities in Lagos State. And my focus is on Lagos Metropolis. Out of the 3 million people with disability in the whole of Lagos, we have close to 2 million of them in Lagos Metropolis. This percentage of disability is too large to be left unattended to. People with disability in Nigeria still face physical as well as attitudinal barriers, lack of access to health and healthcare solutions, significant employment discrimination. They face poor and inadequate access to transport. And generally, people with disabilities are often overlooked in matters that directly affect them, which ordinarily would require their opinion and inputs, has made their life dependent on others. The aspect of inclusive mobility infrastructure has been kind of silenced, and that's my motivation for this study.
You very much for shedding light behind the context and the motivation for particular study on inclusive mobility infrastructures for people with disabilities in Lagos, Nigeria. For our listeners who may not be familiar with this issue, who are people with disabilities and what kind of mobility infrastructures are needed to better support their movement in cities?
According to World Health Organization, disability is a situation resulting from interaction between individuals with a health condition and environmental factors, including negative attitude, inaccessible transportation and public building, and limited social support. According to the United Nations Convention on the Rights of Persons with Disability, they actually define disability as an occasion that may arise not just from health condition, but also from an interaction between a non-inclusive society and an individual. Let me now summarize it with the Nigerian Disability Decree of 1993. They define a disabled person as a person who has received preliminary or permanent certificate of disability to have condition which is expected to continue permanently or for a considerable length of time, which can reasonably be expected to limit the person's functional ability substantially, but not limited to seeing, hearing, thinking, ambulating, climbing, descending, lifting, grasping, and all of that.
Thank you very much. Can you briefly tell us the specific issues or questions that you explored in your PhD research and what methods were used to study them?
My study was focused on the inclusive mobility infrastructure for persons with disability. My first objective was to determine the willingness of people with disability to use the Lagos public transportation system, since that's the focus of my study, which is the BRT system, that's the bus rapid transit, and the light rail system, with inclusive infrastructure for their journey. Are they willing to use Lagos public transport? Another objective was to compare this transport infrastructure on Lagos public transport system with best practices in terms of inclusive design for accessibility of persons with disability. And finally, my study also tried to investigate the impact of inclusive transport infrastructure on the lives, talking about lives of persons with disability now. I looked at the educational, social, employment, and healthcare life of people with disability in Lagos metropolis.
Thank you so much. From these objectives, what were some of the major findings from the study?
Talking about willingness of persons with disability to use Lagos State public transport system, if there are provision of inclusive infrastructure, some of my study revealed that persons with disability are willing to use Lagos BRT and Blue Rail, that's Lagos State public transport system, when presented with the statement of accessible transportation, because the study revealed that most of the persons with disability in Lagos metropolis don't use the public transport system. Majority of them use private cars. They use cab, the shuttle cab. And also, I covered all BRT stations in Lagos State, Nigeria, for my accessibility audits, and also all the light rail stations and corridors were covered for the accessibility audit to actually determine or to know the available inclusive infrastructures. The BRT bus stations assessed for accessible footways, 92% of those stations are not accessible and they are unusable by people with disability. And in terms of inclusive infrastructure too, such as tactile indicator on BRT platform, scored very low as far as inclusive infrastructure features are concerned when it comes to mobility of persons with disability. Then for the light rail system in Lagos State are equipped with inclusive elevators, vertical circulation. All train stations are fitted with inclusive infrastructure for persons with disability. The only gap identified include obstacle-free pedestrian footway for both the BRT and the rail system. Direction and one tactile pavement footways are not there too. There are no inclusive curb ramps. There are no accessible ramps fitted to the footbridge at the 18 BRT bus stations. And there are no inclusive parking at both the Blue Rail and the BRT terminals. Those were the gaps identified.
Thank you very much. So if I understand where there were variations between stated preference and actual usage of the mobility infrastructures for people with disabilities, but what is seemingly not clear to me is what type of questions did you ask people, and particularly for the BRT, where you said they were not actually having mobility infrastructures for people with disabilities? What specific infrastructures did you assess in your audit?
Okay, for the accessibility audit, I started with planning the journey. Are there accessible websites? Are routes and BRT or train stations information provided? I looked at the website having mobility planning requirement form. That's planning the journey for persons with disabilities. Bus train information, routes provision information. Do they have mobility planning requirement form to help persons with disabilities to plan their journey? Getting to the bus stop, what are the infrastructure that should be made available for persons with disability? I looked at the pedestrian footway. I looked at the tactile paved surfaces. I looked at the crosswalk facility. I looked at the drop curb. I also looked at pedestrian signalization. I looked at the footbridges. I looked at the signage facilities. I also looked at the bus stop amenities. Then arriving and using the BRT and the light rail facility, I assessed inclusive parking space for persons with disability. I looked at announcements. I looked at audio and visual announcements facilities. I looked at the ticketing and vending machine. Are they convenient for persons with disability? I looked at the terminal amenities like toilets. I tried to know are stations accessible for wheelchair users. Then I also looked at the signage at terminals. I looked at the station having display signage to inform of bus departure time, platform number, and all that. I also looked at underboarding and alignment. I looked at the platform tactile indicator. Are there directional warning and tactile indicators at terminals for visually impaired travelers? Are there warning tactile detectors provided at the edge of boarding platform? Does the terminal or station have gap-free level boarding for easy access by persons with disability? And I looked at, if no gap-free level boarding, is boarding ramp provided for wheelchair users? I also looked at, are there seats provided the waiting area for persons with disability? Even in the BRT buses and the Blue Rail, are there priority seats for persons with disability? And also getting to the destination on board the train and BRT buses, I looked at, are there handrail and stanchions provided on the bus and train for easy support for persons with disability? Is the bus or train entrance accessible by wheelchair users? I tried to assess if the bus or the train have sufficient space for wheelchair users. I also tried to know if the bus or train have stop request push button. So basically, I looked at the infrastructure that should be in place right from planning to the journey to getting to their destinations.
Thank you very much. From your survey and your experience, what has stood out more for you about mobility infrastructures for people with disabilities in Lagos, Nigeria, and why?
What has stood out more for me is the fact that a larger percentage of them use private car, they use cab. But they also said that they are willing to use the public transport system, provided there are inclusive infrastructure to aid their mobility. And during my accessibility audits that will aid the mobility of persons with disability at the terminal and stations, most of the infrastructure, they are there, but persons with disability are not using it. I think when it comes to accessible ramp, accessible walkway, I think most of the walkways from my study, I think 80% of the footways are not accessible for persons with disability. So that is why it is difficult for them to access the public transport system, which is the BRT and the Blue Rail. And also another challenge is the way we treat those people, the society, the way we treat them, and not only the society alone, and the government Despite the availability of these legislative rights that mandate the provision of inclusive infrastructure, little has been done in that regard. The government need to do more. The organization need to do more in the area of awareness. Like Lamata, for instance, they are the one that manages the operation of BRT system in Lagos State. I think they need to do more in the area of education and awareness for commuters. For instance, I got to one of the BRT stations, and the bus was filled up already, and a disabled person came in to board the BRT, and he was told that all the seats are occupied. I told the driver and the supervisors in the board that no, on no condition should you allow anybody to sit on those seats, because they had to tell the disabled person that the bus is filled already, so therefore he cannot enter. He said, except he will have to stand. How can you tell a disabled person to stand? Meanwhile, his rightful seat has been occupied by an able-bodied person, and they are not even willing to stand up. Even I've seen cases where I see elderly people standing in the BRT bus and their rightful seat has been occupied by able-bodied passengers, which is not supposed to be so. Probably because these commuters are not aware, they are not educated to know that these seats are for this category of people. And some of them that know may not even want to stand up because of the way we treat those people. We don't recognize them. I expected the driver and the supervisors to speak up and ask the people occupying those seats to stand up. But the feedback I got from the driver and the supervisors were, they actually told me that, do I want to cause trouble? That if I ask these people to stand up, that means I want to cause trouble. Yes, I understand that the buses are limited. Having access to another BRT bus may take a lot of time, but these seats are priority seats. Regardless of whatever situation that surrounds the burden of that public transport system, those seats are not meant to be occupied by able-bodied people. They are for disabled persons, senior citizens, pregnant women, and people with health challenges. But people don't know. And those that know are not even willing to treat this category of people with respect, depriving them of their right. So this is something the society needs to work on. This is something our regulatory bodies need to correct. Then also for the train system, where we have the boarding platform, the tactile infrastructure there for the blind, to directional tactile warning indicator designed for them. I discovered that most able-bodied passengers don't know that this particular infrastructure for persons with disability, the blind categorically, they actually queue on that infrastructure to board the train. Their activity, keying up on that data indicator, actually limits their access to that infrastructure. Maybe there's need for awareness, there's need for education on the rights of persons with disability, especially mobility rights, and why it must be respected.
Thank you very much. You already started shedding light on some of the recommendations, practical recommendations that may help to improve mobility infrastructures for people with disabilities. Aside raising awareness and education for these facilities, are there other recommendations that you would like to give?
So now be mentioning the rights of persons with disability, legislative rights of persons with disability. I would like to mention some of these rights. The one that focuses on provision of mobility infrastructure. For Nigeria now, we have the Federal Military Government Disability Decree of 1993 and Section 9, subsection 2 of that decree. And it states that all public transport systems shall take steps to adapt required fittings for needs of the disabled. We also have the Discrimination Against Persons with Disability Act of 2019. This act, Nigeria ratified both the Convention on the Rights of Persons with Disability and its optional protocol on the 24th of September in 2010. And for Lagos State, we have the Lagos State Special People Law of 2011. Section 18, 19, and 20 of that law are all dedicated to provision of facilities in public transportation, assignment of special seats in all modes of transport. And Section 25, subsection 5 of that law specify a transitory period of 5 years from the date of enforcement of the law, within which all public buildings, roads, pedestrian crossings, and all other structures shall be modified to be accessible and to be usable by persons with disability. We have these rights, but what are the implementation in place to make sure that these rights are being attended to? So talking about some other recommendations from my study, I think based on the willingness of people with disability to use the public transport system, they need to be involved in the planning and design of transport infrastructure at all levels. I've always advocated for that at the planning phase of any transport system, get all stakeholders involved, get the general public involved, the users of that system, get the marginalized group. They are part of the general public. And who are the marginalized group? We're talking about the women, the pregnant women, the people with disabilities, senior citizens. Everybody needs to be involved at the planning phase so that their need will be catered to in the design phase. Another recommendation is, in order to fulfill the rights of persons with disability, government and institutions should focus on investment that covers all-inclusive infrastructure necessary to connect streets and pathways to all BRT and Blue Rail stations and corridors. Also, in order to meet inclusive global best practices, there is need for some infrastructure to be available, like the tactile pavement. It should be installed on all BRT stations and ramps provided in all BRT stations and corridors for easy movement of persons with disability. Lastly, government should rehabilitate all broken footways and enforce policies which outlaw traders' obstruction of these footways in order to improve people with disabilities' access to education, social, healthcare, and employment livelihood.
Thank you very much for the recommendation. Before we wrap up this conversation, is there anything else you would like to share, perhaps about your future research plans or what you hope listeners take away from this conversation?
What I want listeners to take away from this conversation is the fact that it is high time we start treating persons with disability as subjects of inclusion, or rather an object of pity, because they have legislative rights. And also, societal behavior towards persons with disability should also change. We try to respect them. We should try to respect their space. Society should give them equal treatment. We should stop the stigmatization, and we should be able to render help wherever needed to this category of people. One of my recommendations is also human as a service, where we have humans designated at various terminals and stations at various bus stops to assist persons with disability. If there is adequate provision of inclusive infrastructure in place, accessibility to health care facility, accessibility to education, accessibility to employment, accessibility to social life will be easy for persons with disabilities. So it is important that we focus on inclusive mobility infrastructure for persons with disability. Thank you very much.
Very much. That brings us to the end of this episode of your podcast on transport in Africa, Dr. Olayemi Dixon. Thank you very much for sharing your insights on inclusive mobility infrastructures for people with disabilities in Lagos, Nigeria. I wish you all the best in your professional and research journey. If you enjoyed this episode or learned something new, please consider subscribing to our page. You can also contribute by sharing this podcast with friends and colleagues who are interested in transport and mobility issues in Africa. If you are a researcher or practitioner working on transport in Africa and would like to share your work on this platform, feel free to reach out to me and we can discuss how to future your work on this show. Until next time, I am your host,